Good morning, everybody. We are live on Facebook. It's Saturday, May 2nd, and we're starting out the month right. We've got Dr. B and Rachel on here, and I want to introduce our producers,
Alexis, stop.
Christine Cano.
Good morning, everyone.
Christine.
Today is, good morning. Good morning, everyone. Today is May the 2nd, once again, and we are ruthless today. I practiced that this morning. Ruthless. I don't know if everybody gets that one. We are Mama Ruthless today, so thank you, Jenny, for doing the introduction. And you know, I've got a new, I guess it's a sharper image smart speaker, and it doesn't get Pandora, so I've had to play whatever kind of music. So it's very, very complicated. I'm here in the wonderful beaches of South Charlotte. So we are excited to finally have finished the month of April, the month that never felt like it was going to end, but it's over. And now we're into May. We have a lot to talk about here. We'll have Councilperson Matt Newton joining us, hopefully during this. I know he's very, very busy. We have Dr. Bahmfalk, who's with us again. Dr. B, thank you so much for having us. We have Rachel, our neighbor, who's returning back with us as well. She had on Wednesday, we had some very good conversation with her. I watched that show 3 times this week overnight, and I'll tell you, it's probably one of the best ones that we've had. And my hair looked really good, so I was.
That's important.
Well,
Better to look good than to feel good.
That's right. Let's go around. And if anyone is watching us, you will see, and I'm trying to pull us up on this big computer here. In order on the screen, we have Baby Trump Pinata, we have Jenny, Dr. B, Rachel, and there's Barbara Bacon. Hey, neighbor Barbara, we saw you trying to come in a couple of times. She's with us as well, and then hopefully we'll have Matt Newton. Matt Newton just tried to call me on my cell phone during the show, and I was not about to answer it, so I know he's having a hard time signing in. So. All right, so let's go around, tell us your button and who you are, all that stuff. So go with Baby Trump Pinata. Hi, Baby Trump Pinata. Thank you very much. All right, next, Jenny. Oh,
Good morning, everybody. This is Jenny-Jaymes Gunn. I'm a coordinator for the Real Out Film Festival for Charlotte Pride. I also am the coordinator for Charlotte Trans Pride, and I'm a board member of the National Organization of Women. But I also believe in the gun sense, Moms Demand Action, and also Medicare for All, which is near and dear. And this pandemic definitely highlighted the need for that.
Next, Dr. B.
Oh yeah, okay.
Sorry.
For a different order, no worries. Yeah, I'm George Bahmfalk and retired physician, and my constant button is Medicare for All, which we certainly right now need more than ever in the midst of this pandemic and everybody losing their employer-provided health insurance.
Rachel?
Oh, me? Okay. Yeah, like all the pictures are in a different order.
Oh, I'm sorry.
So I'm Rachel. I am an employee of the Food and Drug Administration, and I am a filmmaker. I don't have a button on me, but I have a really cool saying on my coffee cup that says, "There's a chance this is bourbon." So that's what I'm showing off today.
That's hilarious.
And then the last but not least.
Me?
Yes.
Okay, Barb Bacon, I'm a community healthcare advocate. Actually, I'm helping a neighbor with a Medicare issue that's been interesting. She got billed for her COVID test. So that's kind of what I do.
Oh. That's what
Excellent.
I didn't get a bill for mine.
I know she did. I don't know why.
Oh.
Well, listen, Jenny, if you can take over just for a second, I'm trying to help Matt Newton get into our, so I've got to switch this computer here. Jenny, our co-host, please.
Oh, hey. Well, I mean, we'll jump right into it. I mean, sorry about that. I had to get up close to read what it was. I'm doing this from my phone. Dr. B, I mean, as far as, North Carolina is probably going to at some point fairly soon start talking about reopening and the stages of that. How do you feel about that? Do you think it's too soon? Do you think it's, you think that Governor Cooper may still extend this, or, you know, do a slow phase in, or what is your kind of take on what North Carolina might do?
Yeah, I really don't have any particular insight into what North Carolina in particular may do. There's this huge pressure in there, right, from both sides, and everybody agrees, yes, we want to open and we need to get the economy back on its feet. And then there's, I think we mentioned it last time about this herd immunity thing, and there was a great article, I think in the New York Times a day or two ago, about what you're not hearing from all those folks that keep saying we need herd immunity. And what you're not hearing is that you can do herd immunity by two routes. You can do it by getting a vaccination, so everybody is immunized by vaccination like we do with smallpox and polio and things like that. Or you can do it the natural way. And the natural way is 60 or 70% of your herd, your entire population, has to get infected and develop natural immunity. And so, you know, what's the population of Charlotte? 1 million? And if the death rate is probably at a minimum of around 0.5 or 1%, what's that going to be? What's 0.5% of a million? I can't do the math here. 5,000 people in Charlotte are going to die in order to naturally get herd immunity and expand that to North Carolina. So the numbers are pretty vicious because we don't have a vaccine, right? So this concept of, yes, we need to kind of intelligently reopen, and with this goal of getting natural herd immunity, it's tough. It's tough. Sweden seems to be taking that route, and that's been in the news a whole lot. And it says Sweden is doing this experiment, and they're protecting old codgers like me, supposedly, and you know, the folks who are at a greater risk of dying from this illness. And they're saying, let's get our young and healthy people out there and let them circulate in bars and restaurants and whatnot, and let's kind of see how it's going. Well, how it's going isn't looking too good. There's a really good website called ourworldindata.org. And right now, if you look at the daily deaths per million, so that's not kind of taking just the raw population of the country, but it's just doing it on a basis. In the United States, we're having just about 8 deaths per million. Sweden is having 10, and right next to it, Norway is having 1.3. And on the other side, Finland, 1.2, Denmark, 1.5. So you go back to Sweden, and they're having 10 deaths per million. That's a lot. It's a small country. They only have about 10 million people in Sweden. But if you look at
one important note with Sweden,
I'm sorry,
Dr. B, is how remote Sweden is. They're not compact, so they have the same population as New York City, but still have. This tells you how contagious and dangerous this really is when you have a very remote, you know, uncompacted city or country like Sweden, and the fact that their death rate is higher than ours says a lot. Yeah. If you don't quarantine, if you don't shelter,
if you don't isolate. Yeah. So that's my concern, that it's hard to kind of ease into this. And of course, you know, I'm all for getting some folks back to work, but I just don't know a safe way to do it. And I'm really afraid that with all these protests and other groups that kind of say, oh, we're just gonna do this, you know, come hell or high water, I think there's going to be a price to pay. I'm afraid we're going to see our numbers kind of pop up here in a little bit. So, I mean, we're looking at Sweden, we're looking at some of the states here at home, Texas and some of these others that have been loosening up. And of course, it's going to be a few weeks before we see any numbers, but I'm apprehensive that the numbers are going to be bad.
Well, and the city that I moved here from, Amarillo, Texas, has an outrageously high rate, and they're starting to open things up. And, you know, one thing that isn't talked about, or one thing that when they say herd immunity, that is not thought about as well. So let's say we open it up and go carte blanche, you know, we only have about a little over 900,000 staffed hospital beds in this country. So about 20% of the cases require some sort of hospitalization out of out of 100. And so if 100 million people get this in this country, which we have a little over 300 million people, so let's say a third of us get it, not even the 60%, 20% of those is 20 million people. So where does the other 19 million people rest themselves when our hospitals are completely at capacity and we're starting to put people in stadiums and parks to recover, and we already are short ventilators? Where do we put the other 19 million people? Do we just say, okay, you're the price for this, and we're going to go ahead and use you as the lambs for slaughter? And those numbers are atrocious. If we were to have 100 million people with COVID, they're obviously not going to be going to work. You know, we're going to be shut down anyway, except we probably killed millions of people because of it.
Well, that's a very good point, Jenny. And thank you, Dr. B, for explaining those numbers. I've never really heard of it from that perspective. And I think it does make a big difference, because we have been hearing about the herd mentality, or what you had mentioned it. And you were the one who brought that up, I think, about 3 weeks ago on our show. And then I saw it in the news, and they were talking about the Sweden. Is that who we're talking about?
Sweden.
Yes.
Yeah.
So listen, before time fails us, I do want to welcome Councilperson Matt Newton. He was able to get in, and I apologize, Matt, if I sent the wrong link. I'm sure. Please welcome to our show. We're just talking with Dr. B briefly, and we have lots of questions for you that we were asking before the show. That's kind of a joke. But before then, I do want to welcome and thank our Pandussi sponsor, Manolo's Bakery, Manolo's Baker on Central Avenue. Same one. And I want to thank, they are making a cake. I believe it's going to be going on sale next week. It's called the Margarita Cake. And I believe I'm getting one on Tuesday. So on Wednesday's show, we can kind of talk about it. Apparently it's to support Cinco de Mayo. I got a text from him yesterday that said, Christian, we have a new margarita cake. I said, I'll eat it. And please, everyone, if you do have a glass, salute to coffee and Pandussi. Ching. All right, thank you. I am actually coffeeless this morning. I'm doing chocolate milk. So I was running just a little late, had a hard time putting my contacts in. And so, Dr. B, and please, anyone jump in if you have some questions, because we're so grateful to have him on the show to answer these questions that many of us have. One of the questions I have.
Questions,
go ahead,
Chris?
Barbara. Please.
I watched CNN this morning. That's when I'm running around getting ready. They had two immunologists or epidemiologists. I did not get their credentials, but they're both from Stanford. Dr. Scott Atlas and Dr. John Ioannidis. They have analyzed all the data, and they're basically saying what the people out there, protect the vulnerable, the elderly, people with pre-existing conditions, people in nursing homes, and this other small subset of people. I'm hoping he meant prisons, but they're going more towards put the people out there. Younger children and babies get it very rarely, and I don't know if the numbers support that. Put the general healthy people out there and let them, if they don't already have it, their premise is that people, 50% of the people are asymptomatic. And I don't know where those numbers come from, but maybe if you have time, if you could, their studies have not, their results have not been vetted yet, and they're welcoming vetting. Apparently they already have 15,000 replies. But maybe, Dr. B, if you could look at those studies and talk to us about it later, because I have a feeling, because this is more the federal approach than individual state approach, maybe it's going to start getting pushed a lot more. But I found it very interesting. But both of them said the same thing. They don't work in the same organizations within Stanford, but they're both from Stanford. And apparently the one guy, Ioannidis, Dr. Ioannidis, is like 150th in the world or something. I'm just telling you what they, and I took notes, but I found it extremely interesting. They're saying basically do what Sweden's doing. And I'm like, oh my God. So very radically different from everything we've been hearing. So.
Yeah, well, that's a view, and we're not going to find out until too late, who's right. So it's kind of a gamble. It's, you don't want to get too extreme because there's a lot of that floating around. But I was thinking last night, it's almost kind of like if somebody comes up and says, okay, let's play Russian roulette. Yeah. And we'll give you, somebody kind of says we need to get back to work. We'll give you $50,000 every time you click it and it doesn't go off. How many times would you play? That seems to be, in a way, kind of what we're faced with. It says, sure, you can go back to work, you can kind of make your income, but you might be dead. I saw some funny, Christian, several weeks ago, you talked about, I need to kind of get a haircut. And I encourage you to kind of think twice about that. And there was some meme, y'all have probably seen it on Facebook. It says, what would you rather do? Go get your haircut now by your barber, or wait a couple of weeks and have your undertaker be doing your hair? And that's about kind of what we're looking at. So I'm very apprehensive about the opening up and going a little bit too fast. And maybe there could be some very specific tailored way to do it. Probably one of the country's most prominent restaurateurs, this fellow who owns Shake Shack, Danny Meyer, who started a bunch of restaurants in New York City, was on some show last night. And he's saying, restaurants can barely make it with 80% occupancy on a regular basis. So this thing about, starting with 25% and 50%, their costs are going to go up more than any kind of income. So the whole thing is just dadgum tough. And so I'm just really concerned about these limited openings and people coming back. It's probably not going to help economically in the long run, and a lot more people are going to get sick and die. So,
Dr. B, you hit on something. Sorry to interrupt you. You hit on something that I think most of us have been thinking, or at least people that I hang around, my silos. It's so interesting that, especially during this global pandemic, and this also happened after 9/11 briefly as well, but I find it so interesting that we have somehow changed to this mentality that if you're a small business owner, no disrespect to small business owners or corporations or business owners, that somehow you are owed success, that just because you own the small business, you are owed to be successful instead of the reason I'm saying this is because that's what we practice with individuals. With individuals, we say, you're on your own. You need to, the government's not supposed to be helping you. You have to, you make the right decisions, make the right choices. Why, as taxpayers, I understand that we need to help the small businesses, but it just seems so unfair with the mentality that we are telling individuals, you have to make it on your own because of the decisions that you've made. You didn't have enough savings. You didn't, whatever job you made a decision to take or a career path. But yet we're telling small businesses, regardless if we think you have a good business plan, or regardless if you were failing in the first place, you deserve to succeed. So it does seem like we're practicing, and I've said this before, we're practicing socialism for our businesses, but we're practicing capitalism for the individuals. So I do think that it's very interesting that, I don't know, does anybody else have a comments on that?
Well, I mean, that's always been the hypocrisy of the right, is that, when I'm in those circles, they'll talk about rugged individualism and self-reliance, and then I'm going, but in the bailout of 2008, Ford and Chrysler and all these really big companies, Bank of America, got all these really big checks scratched to them with no accountability whatsoever, which is massive socialism. I mean, on a grandest scale that we've ever had up until now. And I just find it ironic that happened, and the fact that Trump, at the beginning of his administration, rolled back taxes and gave back to the wealthiest 1% $2 trillion. Yet when we're flapping in the wind is citizens that put him in office and all the politicians in office. They're like, oh, you figure it out. You can make do with this or that. And it's just amazing how the logic doesn't apply to both sides. I totally agree with that.
Is it all right if I jump in? Everyone, hey, it's great to be here this morning, by the way.
Well,
Wonderful conversation thus
please,
far.
Matt, please.
Really great to hear from Dr. George about the decision to stay closed or reopen, and I think I missed the front end of that. I was a bit surprised by the governor's press conference the other day, given where we are with the metrics, and would love to talk more about that, maybe offline. I figure I probably missed some of the conversation regarding that earlier. In as much as small business is concerned, I think it's important to note that small business really is the backbone of our economy. Here locally, we have roughly 90% plus of the jobs in Mecklenburg are because of small businesses. And so I think what's important to note is we're not talking about, so when we talk about supporting small business, what we should be talking about is affording them a competitive advantage in the market that is for them not there in comparison to the bigger corporate entities. That I think, Jenny, you made a really great point, right? That seem to get that support regularly, and I think that that in as much as making sure that everybody can benefit within the economy, we have to support small business, or else we wouldn't have the opportunities for jobs, one, but maybe things like living wages, things like healthcare that you're seeing many of the large corporate entities further whittle away within their business models. So anyhow, I'm a strong supporter of small business, and I think from the standpoint of ensuring that they get the same benefits and opportunities that the corporate entities get, I think that benefits us all.
No, I completely agree with you, Matt, and I admire the efforts that the city and the county are doing, and the reason is because the small businesses have been in many ways at a disadvantage because they're not getting the same help at the federal level. Whereas small businesses pay local taxes, state taxes, and federal taxes. Many corporations don't pay any federal taxes, but yet the federal government is bailing them out, or we are bailing them out. So no, I completely understand that. I guess I just always have this concern because basically what that means is if you are a resident of Charlotte or Mecklenburg County and you're going through this crisis, if you are a employee of a small business and you have been furloughed or laid off, the only assistance you're going to get currently is through the unemployment, and maybe the rebate that people receive. If you just go and register an EIN number, you also qualify for additional assistance. So what is to prevent every individual in Charlotte to just get an EIN number and now be a small business and ask the city and county for assistance?
So 2 points.
That's a general question. I don't expect you to answer that specifically. Because that's what happened after 9/11. After 9/11, when people were hurting, they started these micro businesses, as you mentioned, because they wanted those EIN numbers so that way they can get the tax deductions. They can do the things that only people with EIN numbers or 1099s can do. So for an example, if you are a contract worker and you are you can deduct everything from your taxes, including your gas. If you're an employee, you can't. And so there are many people who just go and get their EIN and become contractors who are what we call micro businesses. And they do that specifically so they can avoid paying certain taxes, but they can also get certain benefits. I guess my point is, just because you have an EIN number and just because you're a small business does not mean that the taxpayers owe you success. I mean, and that sounds like really Republican of me for some reason to say.
Well, I think the question here is ensuring that we're talking about legitimate small businesses, right?
Yes, that's what I mean.
So in your example, I think you're talking about folks that maybe are trying to game the system, right? That are
Yes.
engaging in fraud, and that's something that's something certainly that should not be encouraged. But to the extent that we're talking about legitimate small businesses, I think they do need to be supported, particularly in a time of crisis. That's the role of government, right? So that our economy doesn't collapse, so that there isn't more pain and suffering as a byproduct of an unforeseen circumstance or situation. And so I think that that for me, at least, I think that that ensuring in times like these that we're experiencing today, that small businesses are supported and don't fold, then we need to do that, because it's within everyone's best interest.
So Matt, here's a question. People jump in. I don't want to monopolize this as I usually do. What is the difference between, let's say we had $30 million, okay? What would be the difference between spending that $30 million to help small businesses or spending that $30 million to help people buy products in those small businesses? So one is trickle down economics and one is trickle up economics. So a country like Canada, they have put their efforts in giving the money to the consumer so the consumer can spend it with the business. So that way the consumer decides by their vote, I'm going to spend this money with Manolo's Bakery, or I'm going to spend this money with Harris, or whoever they want to spend. It's not the government deciding where that money goes. And so to me, it would make more rational sense to give that money to the person who's actually spending, and then the consumer, by capitalism, by us, by our votes, our taxes, we decide where that money goes, not the consumer. So that does really sound Republican, but actually that's kind of, I don't know what that is. Jenny, you have any?
I have an answer for that. Not to cut Matt off, but I think there has to be a balance, and when they rush this legislation through the National Congress, what they failed to do was to put parameters and caps on the business side of it. They did it with the normal individual, $600 a week for unemployment and the pandemic assistance program, $1,200 one-time fee or award. But with the businesses, they didn't say, well, you have to be below $50 million in revenue or anything like that. Any business that employ people, and then the caveat was, I think they had to have a certain amount of employees to apply, like 2 or more. And they also primarily did it through the larger banks. So the larger businesses had the best relationships with the larger banks. So they got in the trough first. And it was a very inequitable way they did it. And they should have had an employee cap. They should have had a revenue cap. They have all the numbers since they're doing this through the Department of Revenue. So that they know where they should have capped it at and said, these small businesses need to go first. The only thing I'll say against what you're saying, Christian, and I read an article on a business in Gaston County, because Gaston County is talking about just completely reopening against the state's wishes. And there's a small franchisee there, and she said, even if I could open tomorrow, because I haven't gotten my loan yet, I don't have enough capital to open.
No,
so
that's
I don't have enough operating capital to go out and buy food and supplies that I need.
Yeah, so this is, Jenny, this is what they currently do in Lincoln County. In Lincoln County, what they do is they give vouchers, and this is before any of this happened, they give vouchers who are for their residents, county residents who are retired, and they give them vouchers, and they can take that voucher to any restaurant, any grocery store, anything to buy a dinner, buy whatever. So they are making a decision with that voucher where that money goes. And as a result of that, the best restaurant will get the most vouchers. And so I guess my point is, if we have $30 million in Charlotte, why don't we give individuals that money to spend? Is the concern that they will not spend it? Because aren't the small businesses we're talking about, restaurants, service, those kind of businesses?
You're sounding like a big free market guy right about now, Christian.
Oh, yes.
so I think what's important, so what's the old saying? Teach a person, give a person a fish, they eat for a day, teach them to fish, they can eat for a lifetime. And so I would agree with Jenny that that a comprehensive approach always needs to be taken into account. I think you're talking about food vouchers, which I think have been a very good and effective idea across the country when they've been implemented. But at the same time, if we're talking about the preservation of jobs, making sure that people can continue to work, to continue to have an income really for the indefinite future, rather than just one score in their pocket to go spend. I think, that's maybe the countervailing point where we need to also ensure that the people that the areas where the jobs currently exist, that they are preserved. And I'll say this too. So what we've identified locally, when we talk about the type of EIN, maybe scheme that you had mentioned before, there is a gap for businesses with 5 employees or below. So there is, from the standpoint of federal and state assistance, that has predominantly gone to 50 employees or above. And then to the extent that it has hit small business, it's been between the 5 to 50 employee range. So you're not seeing those benefits, go to 5 and below. And we're looking at that more thoroughly on the city level to ensure that the legitimate 5 and below businesses are getting the support they need.
Well, especially like small contractors, like tree trimmers, like down the road. I had a neighbor they were digging a new well. Well, they probably only have, 3 to 6 employees. And those type of businesses are going to immeasurably suffer because, they typically are not going to be, highly capitalized anyway. And they're more working professional businesses rather than, more hands-on, rather than a large franchisee like a McDonald's.
No, I Jenny, I completely understand it, and I think I'm probably one of the most progressive individuals that I try to be. I'm trying to understand this from what George, Dr. B said 3 shows ago. Dr. B, if you remember, you had mentioned the way that conservatives look at things is they don't like people to get things for free without working at it. Wasn't that something you mentioned, something like that? So I'm visualizing what people who are seeing people getting assistance, what they may be saying is, why do I owe that tree trimmer? No one made the decision. They made that decision to go into that business. They made the decision not to have a rainy day fund. They made the decision to buy that new truck instead of saving that money for a rainy day. So many people of means and many people of means are not as concerned about a lot of businesses because they have saved for this rainy day. And so they see it as, it's unfair that I have saved for this rainy day, but other people haven't. Why is my tax dollars going to them? So we're going to get those complaints. And so, and to Matt's, and I understand what you're saying. I'm not saying that I don't think small businesses need help. I completely agree. I'm trying to prepare us because in 6 months from today, when someone is Republicans, they're waiting to see the opportunities that we did not take during this time period. And they're going to use this and they're going to say, you see, a Democratic councilperson or this, they spent all this money in the small businesses and they failed anyway. And so I'm just trying to bring a different perspective from this because when we were, I was watching the news yesterday about the Gaston County person who wanted to open up, and the Gaston County person said that she can't feed her family. She has to open up her hair place. And my yelling at the screen was, well, there's a lot of people that can't feed their family. Why do you get the assistance from whatever, but an individual who's also a one person doesn't get that assistance? So it does seem unfair that a lot of these small businesses, their employees are their daughter. They're not people who have been laid off, they're family members. If they're under 5 employees, they're not hiring, they're not, they're only, it's a family business. So there's no difference between that business than there is between, and that's what I think a lot of people may be doing. So I have made it as controversial as possible for Matt, as he is so excited to be here. Does anybody want to add anything before we ask Dr. B one more question and then we'll switch to Matt again?
I think, well, real quick on that point, I think, what's important is that we maximize the subsidy, and so a comprehensive approach whereby we are helping with medical bills, helping with rental and mortgage assistance, and then also small business assistance is the best way to maximize dollars to make sure that we have economic stability moving forward. You don't want to put all your eggs into any one basket,
Yes.
of course, but I think from the standpoint of small business, understanding that the vast majority of jobs, at least locally. So I mean, I can speak to the local circumstance.
Yes.
They are sourced through small business, and the need to preserve those jobs so folks can continue to have a steady income in the future. That's why I think we want to put some eggs in that basket.
Yeah. I understand.
Well, and I think Matt's right as far as, the small business, you look at the Chamber of Commerce numbers and all that. But like I lived in Houston for a short while in 2008. And according to the Houston Chamber, there was a little over 185,000 small businesses in the greater Houston area. And small businesses are kind of a mix of being just an individual person and being a business. I mean, so it's hard to separate those. My mom was a restaurateur for over 30 years, and it was her life. It was her social life. It was her everything. And she had employees, and they became family to her. So I think there's a lot of emotion with this, especially with limited resources. I think there is a lot of fear, concern, and when people are scrambling for resources the way we are because we don't have universal health care, because we don't have a UBI, we have people that have the fear of unknown. They're like, what is the government going to do? And
yes, and if you can't tell by the questions I've asked, I am about 3 years ago, I switched from being a trickle down person to a trickle up person. And my view of economics, even though I'm a very conservative, fiscally democratic libertarian, I read this book called Austerity, A Bad Idea. It's by Mark Blythe, who is an economist from Columbia University. And it talks about the failures of austerity economics, which is a trickle down type of economics. He calls it voodoo economics. It has never worked in the history of the world, but we continue to sell it as if though we need to provide the money for the employers, the small businesses, so they can stay into business. The argument with a lot of economists today is we need to go trickle up instead of trickle down. And every time we try trickle down economics, it has failed. It has never succeeded. And so I am a proponent of looking at things that trickle up instead of trickle down, because every time we do try trickle down economics or voodoo economics, because we realize after we've done it, when we bail out the banks, when we do this, we realize, it didn't work. And then we keep doing it again every time we have a crisis. And so it just seems like we have to start having the conversation. Every time we have a crisis, we practice trickle down economics instead of trickle up economics. And or as Donald Trump says to say, what do we have to lose? For 100 years, we've tried trickle down economics and it's never worked. What if we once tried trickle up economics and let's see if it works? And so because there's so many people out there who can't afford to live and who are hurting right now, and just giving them another $2,000 a month will enable them to buy groceries, enable them to pay their rent, enable them to spend their money with businesses that, go ahead, Jenny.
Yeah, well, one big thing, and this has always been a debate between the federal government and the states, and it's not being discussed a lot, is unfunded mandates. So when a government entity, no matter what level it is, does like this quarantine thing, one of their moral obligations to all the citizens, whether it's a business or an individual, is making sure that they fund the mandates. So if we're mandated to stay home unless we're an essential worker, then they are morally obligated and actually legally obligated to fund it. On certain levels, all three levels of government, local, state, and federal, have failed that. They have given us an unfunded mandate and have not lived up to what they should be doing. And they should have started with individual citizens, then small businesses.
Yeah.
And then if there was any money left over, then look at very individualized and have done it more transparently instead of doing a shotgun blast to all these big businesses.
Well, I know, I know, Jenny.
Individually.
Yeah, I know, Jenny, that the reason that Matt is in this position and our city council and our county commission is in this position is because they have to fill the gap that the federal government hasn't done. And so I do realize,
and it's a large gap.
Yes, and so I do.
Jenny, you are spot on. A lot of these folks that are engaging in the reopen protest, they do have a point, right? I mean, they are struggling right now because the social safety net has not been there, and that's on government. And I think that that's an example of many of the mistakes that have been made here over the past 2 months, right? With these PPP loans, for example, they went through the banks, and the banks approved large appropriations to huge corporate interests. And we did it again, on the federal level. Congress, they refunded the PPP program, and the banks are overseeing it again. So, mistakes are being made, and the pain is real. And I don't know if the way that that government has functioned thus far within this crisis has really helped the people that need it the most. And there's a lot of, I think a lot of folks right now that can't pay their bills, that are I think are leaning towards this. We got to reopen for that reason, despite the lives it will cost, and it's a real shame because that's on government.
Well, Dr. B, for example, we could apply the unfunded mandate to medical care. So in a contagion world that we've now been thrown into as a society, it used to be just overseas. We used to just have to worry about SARS and China and stuff like that. But now we're looking at probably this won't be the last wave of things like this. So an unfunded mandate of not having medical coverage for all is a national security problem. I mean, how would you respond to that?
Oh yeah, that's a perfect lead in. There's another one of these little tsunamis that's going to hit before too long is all these folks who have lost their insurance that they had with their jobs, and add them to the 30+ million of folks who are already uninsured in the country. And folks are going to get sick. They're going to come to the hospital, and who's going to pay for it? So that's stressing hospitals right now. There's a proposal that's floating around now that Congress is meeting and whatnot, that fundamentally says, at least as long as this epidemic is going on, until there's a proven vaccine that's available to everybody, let's just put everybody who doesn't have insurance on Medicare. And even people who have insurance, let's cover all their deductibles and copays. Let's remove this barrier to getting healthcare. Well, that's fundamentally Medicare for all. So the proposal is actually kind of a temporary trial run. You can call it an incremental step, or you can call it a public option. That if you don't have private insurance, you're automatically on Medicare for all. That's a type of initiative that I think might really help a lot economically, health-wise, security for the country. And then, that'll be kind of a little test run for, okay, Medicare, how well did you run this? And if Medicare, once this is over, can kind of say, yeah, well, we had all these metrics and it did all this benefit. Well, maybe that'll open some people's minds to the concept of doing that for the whole country. Because if there's one thing that's been demonstrated, it's that having insurance through your job isn't very reliable. And there are tons of folks hurting for the lack of that type of coverage. So yeah, I think now would be the time for anybody who's listening who agrees with that to call or email or whatever your elected officials and say, we support this temporary Medicare for everybody. Is a little baby step, but a crucial baby step for helping with a lot of this economic disruption and desperation of people who can't afford to go get tested or to go see if they've had it, the cough or any of the other kind of symptoms they might be having, and just kind of putting up with. Not a good idea.
And one of the litmus tests for reopening that Italy and China and some of the other countries did was you got to have a certain percentage of the population tested.
Yeah, well, good luck with that.
And even at these other stations, I think the the non-insured pay option for these public stations that the governments have provided, I think it's like 50, 60 bucks, if I'm not mistaken.
Probably so, at least.
And for some people, that's not an option right now.
Yeah.
If you haven't been working for 4 or 5 weeks, you know, 50 bucks is 50 bucks, you know,
Yeah.
it seems like a mountain. And so that's an example of an unfunded mandate crisis.
Jenny, I want to clarify something, because I when I watch this later and I watch this for the next 3 nights, it's gonna. I completely support what our Charlotte City Council, excuse me, and Mecklenburg County are doing, and they have been very proactive in many ways. And there's many ways I think we're all going to learn that maybe we should have done a little bit things differently. But I assure you, if we had a Republican, with the current Republicans on the dais, if we had a majority of them on the dais, we wouldn't be talking about helping small businesses at this time. We'd be talking about giving Bank of America a tax break so they can get through this situation, or the Carolina Panthers a tax break. So I do appreciate the fact that the current representatives that we have right now are doing the best, because they are responding to the concerns that have been brought to their attention. And they're trying to fill the holes that other Congress people have failed, and even maybe some state representatives have failed as well. So I thank you, Matt, for what y'all doing. I know how hard you work. I don't want to sound ungrateful for what you're doing. I was just asking those questions because I try to put myself into other people, how they're looking at it. My family, I think, knock on wood, we have been recession proof after 9/11 and after this. We positioned ourselves that one of us will always have a profession in case the other one, something happens. And not all families have that opportunity to do that. And so I understand there are many families that both of their incomes come from the service industry or hospitality industry. I have traditionally been in the hospitality industry. The other half has been in the financial industry. So we've purposely been opposites. And so there are many, I have neighbors of mine that both of them were bartenders, and they are completely at the mercy of a GoFundMe page right now. And so, you know, those are things that concern me, because I remember how it was like not to have insurance or those kind of things. And so anyway, Matt, I know you want to talk about some other issues with the city council, but the question I have, and I hope Barbara jumps in because I'm going to sound really terrible here. When are they going to pick up our twigs on these and these shrubs?
It looks like a war zone in my neighborhood. I walk every morning, and it's just
Yeah,
like,
we
I'm so
have-
glad you said that.
So a good question. You're not the only one who's asked it, Christian.
I'll bet.
So we have limited crews working right now, and that's because we want to make sure that our city employees are respecting social distancing guidelines. So keep your yard waste at the curb. They will get around to picking it up. I know that folks have had it out at their curbs since last week, but just bear in mind we do have limited crews
they've had
working
it
on
out
that
there
right
for a
now, and they're getting around to it.
You go, Barbara.
So sorry about.
They must not have an HOA.
Sorry about the inconvenience, but this is about protecting the safety and well-being of our city employees and making sure that their families are safe as well. I wanted to mention, so to be clear, I am very concerned about the state opening up too early. I do place a premium on human life, and it's also about compassion for others. So with this virus, you know, maybe someone like myself, younger folks, maybe we have a reduced risk of death, a reduced risk of any sort of long-term, effects of this illness. But it's not just about us; it's about ensuring that other folks who have higher risk don't catch it, because they're valuable as well. So just wanted to say that, in as much as the economy is concerned, I would agree with Jenny wholeheartedly. That falls on government, and I think we've seen a number of shortcomings through our government on a federal, state, and local level here over the past 2 months. There needed to be, and there could have been, a better social safety net to catch folks as they fell as a result of this crisis. And I feel like, so just speaking on a local level, I do feel like we could do more, Christian.
Mhm.
So I really appreciate your comments. And we have been working hard, but at the same time, let's bear in mind that the package that we passed about, I guess it was about 3.5 weeks ago, that appropriated roughly, so just over $2 million for mortgage and rental assistance, $1 million for small, micro businesses in the city, but that really scratches the surface. So in as much as housing and rental assistance is concerned, that's only going to help 700 of roughly 800,000 families.
Yep.
When it comes to small businesses, those micro business grants that we approved, those forgivable loans, which in many instances will become grants, that's only going to help upwards of 100 micro businesses, but we have 6,500 that exist in the city. So we definitely could and should be doing more. My hope is, and the funds exist. Let me be clear about that too.
Yeah.
So we did get an appropriation from the federal government through the CARES Act recently. We'll be looking more thoroughly at that, how we can use that appropriation to benefit the community, to meet, so to identify the gaps and meet the needs that we identify. So we'll be moving forward on that, but we need to do it soon, because it's not as though if we don't do it sooner, then what we're going to find is a ballooning of need later. I spoke with a good friend of mine recently, and the analogy that he threw out there was it's easier to prevent the fire today than it is to fight the 4-alarm inferno tomorrow. And so that's the approach I hope that we take, and we do a better job of moving forward with a real sense of urgency here.
Matt, what was
Yes.
the reason that Mecklenburg County switched to the regs that the governor put out? Weren't we under longer stay in place?
So
Switched to the state, right?
So what happened was the county, in conjunction with the municipalities within the county, instituted a stay-at-home order before the governor did, and ours expired before the governor's expired. And so what had occurred after the governor's order was that the local county order was extended out to meet the governor's order, which expired at the end of last month. At that point, the governor then extended his order out till May 8th, and in the interim, so the county's still subject to that state order, but in the interim, Huntersville and Matthews decided to back out of the county order, and so right now there is no county order. The county attorney stated in an opinion that the county could not move forward with its own order without all the municipalities on board. So there is no county order, but we're still subject to the state order. So so keep that in mind. And in some respects, that state order is actually stricter than the county order. In other respects, it's more lenient. But that is what controls today, and the decisions of the governor is what will be impacting us locally moving forward.
Matt, I have a question. Jenny, you have something to say?
Well, I was going to say that the county order and the state order were very, very similar. Yeah. And had the state, passed theirs 4 days before, then there wouldn't have even been a county order. It was just the fact that the county slightly quicker. They are a smaller entity and they can make decisions a little bit quicker. So I think the nimbleness of the county government in conjunction with the cities of Mecklenburg County, we just had the foresight and the leadership to be able to jump on it a little quicker. But to be honest, I've looked at them side by side, and there's just some slight fundamental differences, but we're still in a stay-at-home order for the whole state of North Carolina.
Question, Matt, is let me try to ask this question without being typically me. Is there any way, can city council members have press conferences to update us if the mayor doesn't do anything? And I'm not trying to be facetious. I'm trying to be these confusions, the reason we have these questions from people is because our mayor does not meet and say, this is what's going on in the city. This is the reason. We wouldn't have these questions if the mayor just simply, did what other mayors do. But the only thing that our mayor is doing is she had a Zoom webinar thing the other day to act like she's been working for small businesses. She has an Ask the Mayor thing on Twitter, but she doesn't I look at other cities and other mayors that are saying, this is what's going on. We said we're gonna pick up limbs and shrubs on the 27th, but we're not able to. Exactly how you explained it makes logical sense. So because she doesn't come in front of us and tell us, everyone, it's gonna take a little bit longer, people wouldn't build up their anxiety and excitement if you just were transparent and told us exactly like you're saying it. And so is there any way, and I know the answer to this, I'm just answering the question, that you can have those press conferences, or maybe you and someone else?
So,
Right.
it's definitely a loaded question. so the mayor does speak for the city. The mayor interacts with the other mayors across the state and the country, and also the governor on our behalf. So I would be hesitant to ever get in front of the mayor in that regard. But what we can do, and so what you're probably noticing right now is there are a number of council members who are holding town halls.
Yes.
I've actually so if I can put a plug in on this, myself, Council Member Ajmira, and Council Member Johnson will be holding a town hall on Wednesday to talk about small business assistance. That's going to be 10 a.m. It's going to be virtual. You can go to MattNewtonfor5 on Facebook, and it will be broadcast there. It will also be broadcast on the City of Charlotte Facebook page as well. But yeah, those are so those town halls, I hope, are informative. And in as much as us getting the information out there about what's going on within the city, that is an obligation I feel like we all have as council members. And my hope is that all it takes is, just reaching out and asking.
Exactly.
So within wherever you live, you have a council representative for your district. You also have 4 at-large representatives you can reach out to, and we should all be able to answer those questions.
I did want to ask
Excellent.
Rachel a thing, because we haven't really talked to her and she's been on the whole time. I wanted to know an update of how you're doing since Wednesday, how you're feeling.
Good question, Jenny.
And what is going on in your life right now, if you can share.
Thank you for asking. I'm not feeling great today. I felt okay on Wednesday. I'm not feeling great today. I'm having some trouble with my oxygen in my blood. I did find out that I have scarring from COVID in my lungs, so that is going to be something that I am going to have to live with for the rest of my life. And but yeah, I wanted to. Sorry, I'm having trouble breathing. I do want to say that I'm a little frustrated by the lack of consistent messaging in terms of, city, county, state. I think a lot of people are getting frustrated with that. And I think that I don't go out a whole lot because I can't, but my husband tells me that there's a lot of people who are not practicing social distancing, following guidelines, and it's because they're confused about what guidelines are. So, whoever brought that up, I wanted to touch on that. I think people are taking matters into their own hands, I think, so to speak, because they don't know what the guidelines are. And I'm frustrated myself. Like I had this, and I'm still dealing with it. And I'm going to be dealing with it. This is going to be a long-term thing. And I think we're going to see a spike in people getting sick because they don't understand what is expected of them. There is no transparency if you ask my opinion on it. I'm very frustrated by the lack of messaging. I think if there's more messaging, people are going to understand why this is important. Because trust me when I tell you, you do not want this virus. It is absolute hell. I had it for 6 weeks. I'm starting to get better, but I do have permanent damage from it. And we're going to see a lot of people suffer the same thing. They're going to have medical bills. I'm terrified about my medical bills because I don't know what it's going to be. So, you know, it's going to cause more chaos. So I think that if there was more of a collective effort, I think that would change a lot of things. And I think it would help people understand why people
What-
are frustrated.
Rachel, I have always said, and Ruth and I said this about 3 weeks ago, it woulda, coulda, shoulda, but it would have made a huge difference had our mayor, when this first broke out, the same effort she did that big press conference for the lending tree guy and all that kind of stuff, with the same effort,
Yeah.
she did a very simple video on YouTube saying, where if you're in a Black and brown community, wear a mask, don't take your kids to grocery stores, follow the arrows, go this way.
Mhm.
Something so simple like that would have
Yeah.
helped and can still help. It's not still can still help and say, you know, when, you know, I agree. I mean, and just explain things to people. And so it does make a huge difference when our leaders, like, we're fortunate to have someone like Matt who can step up in a time of leadership, but there are many leaders who we have not heard from, and they are influencers. And there are people that follow.
And that's why, you know, that's why I appreciate Matt, you being on here, is because, you know, I feel like as someone who is still kind of on the tail end of this and still going through with it, I'm being unheard. I feel like I have a lot to contribute because I did live with this for so long. So I think not only government people should get together with consistent messaging, I think you should talk to the citizens, people like me who kind of know where the failures were and try to come up with a solution for that. Because, you know, I'm assuming you haven't had COVID. I'm assuming no city council had it. I'm not sure. But if you don't understand that point of view, you're not going to be able to come up with guidelines in terms of what the citizens need, also do it under whatever the government needs are. Do you know what I mean?
Yeah, absolutely. And if I can be frank, I feel like we haven't. So the city as a whole has not treated the situation with the seriousness that it deserves and the urgency that it deserves.
Correct.
That has been a major frustration of mine. I'll give you an example of what I'm talking about. It was probably 5 or 6 weeks ago that I started asking about the PPE that our employees had, which was none, right? And we had a policy where employees couldn't bring their own PPE. So the city wasn't providing PPE for our employees. At the same time, we were not allowing them to bring their own. And so it was just no protection whatsoever. So that took weeks to get changed. And even to this day, now, thankfully, we do have channels now and a contractor who is providing PPE for us in bulk, so our employees are protected. But it took weeks to get the policy whereby employees could bring their own PPE changed, and to the extent that we were. We didn't have enough PPE to supplement with employees bringing their own to work with labor. We could have collectively covered everybody. And so it's that type of creativity that is necessary. Cutting through the bureaucracy is necessary in a time of crisis. And we were operating then as if it's business as usual. And in many respects, we're doing that today with these task forces, where we're meeting to talk about what we already know. Right? I mean, all we have to do is open the paper and identify that the need exists, right? And if we have the money to address the need, why not go ahead and do it today before it's too late? So I definitely hear and understand all of that. I can't think of a situation when we had the discussion about our reserve fund, $116 million, right? It is earmarked for crisis, for situations like this. I can't think of one in which, it would be more deserving. We have 65,000 people at this point, right? That have died. That is more people that have died in a 3-month span than the entirety of 12 years of the Vietnam War. So I hear you, Rachel. I'm with you. I would implore everybody to just reach out to elected officials, express your concern, express the seriousness of the situation and the need for us to act more urgently. And I think we're getting there. Let me say that too. I do think we're getting there, but it has been a very frustrating experience for me over the past 2 months to try to make sure that we get there quicker.
Matt, I've got a question.
Something I think you should have. So I know, Christian, you want to close it.
No. I want to value y'all's time. If you're willing to talk a little bit more, please.
Yeah, I suddenly kind of got all these things in my
Okay,
head.
yes.
Would it be possible to put patients on that task force? Because these people on the task force don't understand the severity of this virus. They don't understand how close to death, I or other people have come to. Is that a possibility to bring in a different voice and just sort of come up with solutions with people who make the policies and have people on, not necessarily, it doesn't have to be me, but have patients on that task force because we understand it. We understand the seriousness of this thing.
So I don't see why not. So there were 3 task forces that were created, one for small business, one for housing needs, and one for the airport. I feel like the more voices, the better, of course. At the same time, I'm not sure which task force would be the more appropriate one. At the same time, I also want to mention that those appointments occurred a couple of weeks ago, were directed by the mayor and the chairs, so the organizers of the task force, the task forces themselves, and those are the folks that would make that decision. I'm completely on board with including more voices, but unfortunately, I'm not in a position to make that decision. And I think this is a conversation that doesn't it shouldn't just be happening on the city side. It's a conversation I think we need to be having on the county side as well, because they're going to be feeling those needs that we aren't feeling on the city side. And so I talk about airport, I talk about housing and small business. There'll be many other needs that the county will be addressing too, or should be addressing.
One thing
I have one more question, actually. Are there any plans in place to put more testing out there? Because I know for me, when I first got this, I was not able to get tested because there were so few testing kits. And I understand there's more now, but is there a plan to get everybody tested? Because there's at least 50% of the people of the population walking around without symptoms and they don't know that they have it. I'm wondering if there's a plan in place to just get more testing, because then you're getting more accurate data as well. And then when you get more accurate data, you can put in guidelines about when we can reopen, and it sort of leads to a chain thing, but it comes down to testing.
Yeah, it's scary, isn't it? I heard, so I saw a report that showed that folks are the most contagious a day or two before exhibiting any symptoms. How scary is that? And so for me, I think that really underscores the need for us to stay apart for the stay-at-home order until we get this thing figured out.
Mine was sudden onset. I didn't have symptoms leading up to it. I got sick one day. By the end of the day, I was in respiratory distress. It came on so quick. This is unlike anything I've ever seen.
Now I don't have Rachel. I don't know where we are with testing. What I've been told is that that's the county's responsibility. We're leaning heavily on Atrium and Novant Health in that regard, and right now they're only testing for folks that are exhibiting symptoms. And I think that's due to a lack of testing kits and resources to test everyone. We don't have the testing for so the antibody testing doesn't it's not here either. But I'm with you. I feel like we have to ramp up the number of tests that we have. I think that's something that has been identified by the governor, but we don't have those tests yet, which is one more reason why us opening up might be a bit premature. So
Yep.
having
No,
said all
I
that,
totally agree. I think it's irresponsible to open up at this point.
Well, I'll
Yeah.
jump in. I know that our time is short, but the one thing I was going to say, it's not really a question, but more of a statement to Dr. B, Matt, and Rachel, is that maybe we need to have a medically based town hall where we have
Exactly.
county,
Yes.
local city governments.
Exactly.
And
Yes.
we have COVID survivors like Rachel, and then medical experts like Dr. B, experts from Medicare for All,
Yeah.
paraprofessionals that have
I
been on the
so agree. Matt, make it happen.
and have
Yeah.
a policy.
I'm taking notes. I'm taking notes, guys.
And
Jenny.
also to be able to share the resources of what's out there right now for individuals, and guidelines, so be able to ask those questions by the county and city health officials and the people that are actually fighting this, and the people that have the medical expertise, like a person like Dr. B. I think
Yeah.
that would be more service than anything else. At the very least, it'd be a great fireside chat to help people.
Exactly. Jenny, you are so correct, because that was the kind of the notes that I was making. I do know that there is a small business virtual show going on right now, so I want to kind of bring this to a close. It is, I believe, Congressman Adams or someone else is having this. It started at 11, so I apologize. But I do want to thank everyone for joining us so much. Jenny, and let's talk about, maybe we can talk about this off the show, but I do want to say, Matt, your meeting on Wednesday is very important. We may want to move our show back, or maybe do something different, so that way we can stream their.
Oh,
what
that's
they're
right.
doing.
Yeah.
So
Yeah, I really appreciate
no,
that.
I mean, I think it is important because we just don't have updates like you're giving us enough. And unfortunately, I'd rather have so much information that people go, okay, than going, what's going on? What's going on? And no matter what Zoom call you go on, whether it's a candidate or an elected official, you can tell people are completely confused on what's going on. And a lot of them are too embarrassed, because they're like, I don't know, am I applying for unemployment? I can't get through. And it's just, and so what I was going to say is, I agree with you, Matt. When the mayor formed these task force, thousands and thousands and thousands of people in this city rolled their eyes, because it's like the Titanic sinking and saying, the captain saying, we need to have a task force on who's going to be on the boat, who's going to plug the hole. There's no sense of urgency, because those of us who remember the immigrant task force, all the task force that the city does, it took a year and we still don't get anything done out of the task force. So I agree with you. The task force came across as, people are asking me questions, I need to kind of pass the buck and do something so it looks like I'm addressing it. Anyone with common sense knows that those task force were only for political cover, that there was nothing that we thought was going to come out of those task force. Now, I know you guys would do something, but there's no sense of urgency in those task force. And so I want to say that. I also want to say that testing, I want to thank you, Matt, personally, for the efforts that you've done to try to get testing done in a lot of areas that normally have access. I know you work with Novant to get some testing free or reduced cost.
East and West side,
your
yes.
efforts,
Yeah.
yes, and because of your efforts,
East and West side,
also,
and making sure that through Novant, I'm sorry to cut you off, Christian, but it's so important that the testing is available to everyone, particularly vulnerable communities, because that's where we're seeing the outbreaks occur. And if we don't target the areas where the outbreaks are, which once again are the vulnerable communities, then we're just going to see this spread even more and become less, something that can't be contained, less.
Exactly.
Less approachable and solvable, resolvable.
Well, it was because of because of what y'all did. You in the county were working on Mark Jarrell. Other people have been working hard to get testing to those communities who maybe don't always have access to a doctor or to some of the positions that we have. And because of that, it had I don't think it was planned. That was the only way we knew that our LatinX community test scores were actually higher than we thought. because they happened to live around those areas and they were going to get testing. And because they had access to more testing, we saw a rise in LatinX numbers.
Yeah.
And it was, it didn't take a rocket science or maybe even a neurosurgeon, we have one on the show, to realize we knew, I mean, Ruth and I, we knew that our Latinx community was not practicing social distancing. All it took was to go to one of the grocery stores and see how crowded they were. And
But also too, Christian, if nobody understands the guidelines, because
yeah, exactly.
nobody's been consistent, persistent, and I think if we would start doing some of these series of town halls, and it's something that's fairly easy or organized, I mean, I'd even volunteer the show to host some of the town halls. You know, of
course, yeah, we'd love to.
We you know, in between us and so many other organizations like ID9 and everybody else, I mean, we need conversations going, you know.
Well, we'd have to make it non-political. And ID9 is all about politics. Yeah,
that's true.
So,
that's true.
Listen, thank you so much, Matt. And thank you, Dr. B, for, I hope, I want to say this. I have seen Dr. B's hair grow in the last month. And I'm going to get a picture of the very first Zoom that we had and then put it next to this one. And you in my community, we say, you got some good hair.
Well, thank you. I'm told that I may have to resort to a rubber band here before too long. It's my old hippie kind of coming out.
Yeah, I like it.
I think you're rocking it.
All right. Well, listen, thank you, everyone. Please tell us where you're going to be, and we're going to sign up the show. If you're on this panel list and you can, just stay on for 5 more seconds, because once everybody tells us where you're going to be, we're going to stop the Facebook, but we will still be on Zoom for just 5 more seconds. I can thank you personally. Thank you, Rachel, for joining us today. Thank you for asking the questions. I know you were not feeling too well, but thank you so much. It's important to get your perspective as well. So listen, everyone's screaming, they look different. Baby Trump will skip you. Jenny, Dr. B, Rachel, Barbara, and Matt. So start with Jenny. Where are you going to be in 30 seconds?
I'm going to be watching the comedy show on Barely Funny this coming Thursday. So that's a little plug for Lauren Ansley, that's been a big supporter of our show.
I'm going to be holed up in my little apartment trying to stay safe and healthy and doing what I can to advocate for this kind of emergency Medicare for All proposal as part of the next relief package.
I'm out of quarantine technically, but I'm still going to stay home, and I'm still going to be really loud about the things that this city needs. Hint, hint, Matt.
I love it.
Well, I'm going to be helping my neighbor try to figure out why she got billed, and I'll go through the channels that I normally do to try to help her, but she's 80 and she's stressed, so.
Mayor?
Mayor.
And is it my turn?
Yeah.
Yes.
And I am going to be at home sitting in on countless Zoom meetings here in the next week. We do have a budget meeting on Monday night. We're going to be talking about funding sources coming from the federal government as well, which I think is going to be a very important conversation, particularly given the crisis that we're now in. And then also, so I'm so sorry, it didn't even occur to me, Christian, about the conflict between the town hall and Coffee and Pan Dulce. But we do have a town hall next Wednesday at 10 a.m. That got rescheduled because of a neighborhood association Zoom meeting that I'm going to be on later that afternoon. So that it is at 10 a.m. and you can jump on the City of Charlotte Facebook page or my own Facebook page, MattNewtonfor5, and watch that. That's going to be in conjunction with council members Ajmira and Johnson.
Excellent. Well, thank you so much, everyone. Because of the new county rules matching the state rules, the county boat ramp at Copperhead at Lake Wiley is officially open. We may actually, I'm almost embarrassed to say this, we may actually try to put our boat in on Sunday. Just stay away from people, but just see how that works.
Hi, Chris.
Oh, it's going to be gorgeous. It's going to be good. So we'll see what happens, but otherwise we'll be following everyone as well. I want to thank Jenny and all the people from Charlotte Pride for doing the virtual show that they did last night. It was recorded for Pride. As many of you know, it was a very painful decision. Jenny, maybe in 15 seconds, tell us what occurred with Pride.
Well, we did cancel Charlotte Pride for 2020, obviously for health and safety reasons, which is normally in August. But we are doing a Real Out virtual film festival starting May 7th, and then we're doing a week of entertainment on starting May 11th. So there'll be 10 plus days of entertainment. It's all free. You can go on Charlotte Pride Facebook page and reserve your Real Out tickets for now. And they'll send you daily emails and tickets. And then fairly soon this week, we'll start putting up our event pages for the week of entertainment, which runs from Monday, May 11th to May 16th. There's 7 shows in 6 days, all free of charge. You can tip the entertainers if you'd like, and it's going to be fabulous.
Well, listen, thank you so much. And I know that what we will be doing when this is over, I don't know if it's ever going to end, but it's changed the way we live. We're going to be thanking the heroes that stepped up to the plate during this time period. Matt Newton, you definitely are one of them. I want to thank you. Thank you for being out there. And I'm sure you're getting a lot of pushback from people saying, why are you so engaged? Why, don't worry about, so thank you for doing that. I also want to thank the people who run the St. Patrick's Day here in Charlotte, and Charlotte Goes Green. They were the first people to cancel their event March the 15th, that weekend, when they were supposed to have the big parade. It's not until now that we realize that that may have saved many, many lives in our city, in our county, in our state, because we know, I think, Dr. B, from the data, that the reason that people in Louisiana was because they had the Mardi Gras parade. And after the Spanish flu, Philadelphia had their parade. And so that decision that they made in conjunction, I'm sure, with talking to the city and so forth, or the county, making that, because they could have just had that parade and festival. And the decision they made, the people who run that thing, I want to thank them so much for saving us, because I probably would have been the person out there, drinking my green beer and wearing my kilt. So anyway, thank you, everyone. We're going to start the music, and we're going to cut off Facebook. Alexa, play music. All right, well, let's act like there's music.
I'll sing.
Yes. Bye.
Bye.